Have you ever noticed that sometimes your memory isn't as sharp as it used to be? Or maybe you've walked into a room and forgotten why you went in there in the first place. These things happen to all of us at some point, especially as we age. But for some people, these small lapses start becoming more frequent, leading them to wonder, is this just a normal part of aging, or is there something more going on? It's completely natural to be concerned about your brain health as you get older, but there's something important to know. Many common medications that older adults take can contribute to memory problems, confusion, and even symptoms of dementia. It's a topic that doesn't get talked about enough, but it's something every senior should be aware of. In today's video, we're going to dive into 10 common medications that could be affecting your brain health. You may be surprised to learn that some of the medications you've been prescribed for other conditions could be having an impact on your memory and mental clarity. Now, before we jump into the specifics, it's important to remember that just because you're taking a medication that could have cognitive side effects doesn't mean you should panic. It's all about awareness and making informed decisions. If you've noticed any changes in your memory or mental sharpness, you should definitely have a conversation with your doctor. Together, you can explore alternative treatments or adjustments to your current medications. So, let's get started with the first few medications that might be affecting your brain health, starting with something that many seniors take for arthritis or pain relief. 1. Anticholinergic medications. You might not recognize the term anticholinergic right away, but chances are, you've heard of medications in this class. Anticholinergic drugs are commonly used to treat a variety of conditions, including allergies, asthma, depression, and even overactive bladder. They work by blocking a chemical in the brain called acetylcholine, which is involved in memory and learning. Some common anticholinergic medications include Benadryl, which is often used for allergies or as a sleep aid, and antidepressants like amitriptyline. While these medications can be effective for managing symptoms, they come with a significant side effect: they can impair your cognitive function. Long-term use of anticholinergic medications has been linked to an increased risk of developing dementia. If you've been taking one of these medications for a while, it's worth discussing with your healthcare provider whether there are alternatives that might have fewer cognitive side effects. You don't need to make any changes without their guidance, but sometimes, a simple switch can make a world of difference. 2. Benzodiazepines. Next on the list are benzodiazepines, a type of medication commonly prescribed for anxiety, insomnia, or even to help with seizures. You might recognize names like Valium, Xanax, or Ativan. These medications can be incredibly helpful in the short term, but when taken over a long period, they can have a serious impact on brain health. Benzodiazepines work by slowing down brain activity, which is why they can be so effective at calming anxiety or helping you sleep. However, over time, they can impair memory and cognitive function. Many studies have shown that long-term use of benzodiazepines can lead to memory problems and even increase the risk of developing dementia. If you've been on benzodiazepines for an extended period, it's important to talk to your doctor about whether there are safer alternatives to help manage your anxiety or sleep issues. Sometimes, a combination of lifestyle changes, therapy, and other medications can provide relief without the cognitive risks. 3. Statins. Now, let's talk about statins, which are commonly prescribed to lower cholesterol and reduce the risk of heart disease. You might be familiar with medications like Lipitor, Zocor, or Pravachol. Statins have been a game-changer in heart health, but recent research has suggested that they could also have an impact on brain function. For some people, statins can lead to side effects like memory loss, confusion, or even a general feeling of mental fog. This is especially true for people who are on high doses or have other health conditions that affect their brain health. However, it's important to note that the relationship between statins and dementia isn't completely understood, and for many people, the benefits of taking statins outweigh the risks. If you're concerned about the cognitive side effects of statins, talk to your doctor. They may suggest trying a different statin, lowering your dose, or exploring other ways to manage your cholesterol without impacting your brain function. So, as you can see, some of the medications that are meant to help with one aspect of your health can end up affecting your brain in ways you may not have expected. Now that we've covered a few of the medications that could be impacting your cognitive health, let's move on to some other commonly prescribed drugs that might be contributing to memory problems or confusion. Stay with me, there are more medications to discuss, and each one plays a unique role in how your brain functions as you age. Now that we've discussed a few medications like anticholinergics, benzodiazepines, and statins, let's keep going and explore a few more common drugs that could be affecting your brain health. These are medications that might not immediately seem to be linked to cognitive issues, but they can have a surprisingly significant impact over time. 4. Sleep aids. A lot of people struggle with getting a good night's sleep, and when that happens, many turn to over-the-counter sleep aids for relief. Medications like Tylenol PM or Unisom are commonly used to help people drift off to sleep. These sleep aids typically contain diphenhydramine, an antihistamine that makes you drowsy. However, what many don't realize is that this same sedative effect can also impact your cognitive function, particularly if used regularly. While sleep aids can help you get some rest, they can leave you feeling foggy or confused the next day. Over time, regular use of these medications can affect your memory and cognitive sharpness. This is especially concerning for older adults, as our brains naturally experience some decline as we age. So, if you rely on sleep aids to get through the night, you may want to talk to your doctor about other, safer options for improving sleep without compromising your brain health. 5. Proton pump inhibitors, PPIs. Next up, we have proton pump inhibitors or PPIs. These are medications used to treat heartburn, acid reflux, or ulcers. Drugs like Prilosec, Nexium, and Prevacid are widely prescribed for managing stomach acid issues. PPIs work by reducing the amount of acid in your stomach, which helps prevent heartburn and ulcers from occurring. However, recent studies have raised concerns that long-term use of PPIs may have unintended consequences on brain health. People who use PPIs for extended periods might be at an increased risk for developing dementia. The exact reason for this is still unclear, but it's believed that PPIs can interfere with the absorption of essential vitamins and minerals like vitamin B12, magnesium, and calcium, all of which are crucial for brain function. If you're using a PPI regularly, it's worth having a conversation with your healthcare provider about how to minimize your risks while still managing your acid reflux or heartburn. In some cases, lifestyle changes, such as altering your diet or eating habits, can reduce the need for medication, or your doctor might suggest a safer alternative. 6. Antidepressants. Depression is common among older adults, and many medications can help improve mood and overall mental health. However, some antidepressants, particularly tricyclic antidepressants like Elavil and Norpirmin, can have side effects that affect your cognitive abilities. These medications are known for their sedative properties, and while they may help with sleep and mood, they can also lead to memory problems, confusion, or even disorientation. Another class of antidepressants, selective serotonin reuptake inhibitors, SSRIs, which includes medications like Prozac and Zoloft, is generally considered safer when it comes to cognitive function. However, even SSRIs can sometimes cause side effects like drowsiness or difficulty concentrating, particularly in older adults. If you're taking antidepressants and noticing changes in your memory or cognitive function, it's essential to discuss this with your doctor. There are many ways to manage depression, and sometimes switching medications or exploring other treatment options, such as therapy, can reduce these cognitive side effects. 7. Antipsychotics. Antipsychotic medications are primarily used to treat conditions like schizophrenia, bipolar disorder, and severe anxiety. However, they're also often prescribed to manage symptoms of dementia-related psychosis, such as aggression or agitation. Risperdal, Seroquel, and olanzapine are some of the most well-known antipsychotic medications. While these medications can be very helpful for controlling certain behaviors, they come with significant risks, especially for older adults. In fact, the FDA has issued warnings about the use of antipsychotics in elderly people with dementia, as they may increase the risk of death. These drugs can also lead to memory problems, confusion, and overall cognitive decline. For seniors with dementia-related symptoms, it's crucial to work closely with a doctor to explore safer alternatives or manage symptoms in ways that won't further impair cognitive function. Sometimes, therapy or behavioral interventions can help manage symptoms more effectively without relying on antipsychotic medications. 8. Opioids. Opioids are powerful painkillers that are often prescribed for chronic pain, especially for conditions like arthritis or after surgery. Drugs like OxyContin, Percocet, and Vicodin are common opioids that can provide relief, but they come with some serious risks, especially in older adults. Long-term opioid use can lead to confusion, memory problems, and difficulty concentrating. It's also well documented that opioids can increase the risk of falls, which is a significant concern for seniors. These medications affect the brain in ways that can lead to sedation, cognitive decline, and even contribute to a state of mental fog. If you've been prescribed opioids for chronic pain, it's important to have regular check-ins with your doctor to assess your need for the medication and to explore other options for pain management. In many cases, physical therapy, lifestyle changes, or alternative treatments can offer relief without the cognitive risks associated with opioids. So, as you can see, medications that may seem harmless or are prescribed to improve one area of your health can sometimes have unintended consequences on your cognitive function. But it's all about awareness. Understanding the potential risks and having open conversations with your healthcare provider can help ensure that you're making the best choices for your health and your brain. Now that we've covered some of the more commonly prescribed medications that can impact your memory and cognition, let's keep moving forward to explore even more drugs that might be affecting your brain health. We've already covered several medications that could potentially affect your brain health, from sleep aids to opioids. Now, let's talk about a few more drugs that are commonly prescribed and how they could be contributing to memory loss, confusion, or cognitive decline. Remember, this isn't meant to alarm you, but to give you the awareness to have informed conversations with your doctor. 9. Beta blockers. Beta blockers, like atenolol, metoprolol, and propranolol, are medications commonly prescribed for heart conditions, including high blood pressure and irregular heart rhythms. These drugs work by blocking certain receptors in your heart and blood vessels, helping to lower blood pressure and reduce the strain on the heart. While they are essential for managing cardiovascular health, beta blockers can also have some effects on your brain. For some people, beta blockers can cause fatigue, dizziness, and even problems with concentration. These medications can also interfere with short-term memory, making it harder for people to recall certain details. In addition, they might also make you feel foggy or less mentally alert. If you're on a beta blocker and noticing that you're feeling mentally sluggish, it's a good idea to talk to your healthcare provider. There may be alternatives or adjustments that can be made to help improve both your heart health and cognitive function without compromising either. 10. Diuretics, water pills. Diuretics, commonly known as water pills, are prescribed to help manage conditions like high blood pressure or fluid retention, often associated with heart failure or kidney disease. Medications like Lasix, hydrochlorothiazide, and spironolactone are commonly used to help the body eliminate excess fluid. While diuretics are very effective at reducing fluid buildup, they can also have cognitive side effects. These medications can lead to dehydration, which in turn can cause confusion, memory issues, and a general sense of mental fog. Dehydration is particularly risky for older adults because it can affect electrolyte levels in the body, which are essential for brain function. If you're taking a diuretic, make sure you're staying properly hydrated, and talk to your doctor if you start feeling confused or mentally fatigued. Sometimes, adjusting the dose or switching medications can make a significant difference. Now that we've discussed 10 common medications that could potentially cause dementia or memory issues, it's important to wrap things up with a few reassuring thoughts. First, let me stress that medication is an important tool in managing various health conditions, and many of these drugs have life-saving benefits. The key is balance and awareness. If you are taking any of the medications we've talked about today and are noticing changes in your memory or cognitive function, don't panic, simply reach out to your healthcare provider. They can assess whether your current medications are contributing to any brain-related issues and may suggest alternatives or adjustments. Taking an active role in your health is one of the best things you can do, and by staying informed, you can ensure that your brain stays as sharp as possible as you age. It's not just about what medications you take, it's also about how you take care of your brain in general. Healthy lifestyle habits, such as regular exercise, a nutritious diet, staying mentally engaged, and keeping social connections, all play a huge role in maintaining cognitive function. Remember, small changes can make a big difference when it comes to your health. Even simple steps like staying hydrated, managing stress, and getting enough sleep can have a powerful impact on your brain health. And if you're ever in doubt, don't hesitate to ask your doctor about the medications you're taking and whether there are safer alternatives for your long-term well-being. Lastly, I'd love to hear from you. Have you ever noticed a change in your memory or thinking while taking certain medications? Or maybe you've had a conversation with your doctor about alternatives to some of these medications. Feel free to share your experiences in the comments below, and let's learn from each other. And if you found this video helpful, please give it a thumbs up and subscribe for more tips on how to live your healthiest, happiest life at any age. I'm so glad you're here, and remember, your brain is precious, so take good care of it. Here's to living your best life at any age, with a sharp mind and a healthy body.